so happy to be here talking to you today. I'm very honored. But we're going to first just talk about the basics of kidney cancer and kind of talk about different things. And we're happy to answer questions at any time. So first, let's just talk about the kidneys. What are the kidneys? They're two kidney bean-shaped organs about the size of your fist. They live in your back, and they're protected by your rib cage. Most of the time, your kidneys live back there, but there are other genetic or other variants that could potentially happen in. Let's see. Oh, I don't think I did my slide. I'm so sorry about that. Okay, we'll go to the next slide. What do kidneys do? Most have two kidneys, and these two kidneys filter your blood, about 50 gallons of blood a day. The kidneys filter this blood, and all of the things that they filter come out of your system as urine. They also are very important for blood pressure, as well as hormone balance, as well as making hormones that are important for bone health. And they do a lot. They're small but mighty organs. Now, how common is kidney cancer? In the U.S., about 81,000 patients this year alone will be diagnosed with kidney cancer. It's more common in older patients over the age of 55. It's also more common in men than women. The good news is that many kidney cancers are actually found really early, and we're really able to treat these. Kidney cancer develops when kidneys, benign cells, they start multiplying at a rate that is abnormal. Normally, normal cells die off, but in kidney cancer cells, these abnormal cells continue to live on and proliferate, which means that they keep going. Over time, they can clump together and form masses called tumors. And some tumors remain small and remain inside the kidney, but sometimes they actually travel outside the kidney, something called metastasis. And, there's a few different things about kidney cancer that we'll kind of talk about next. Many kidney cancer comes from the filtering units inside kidneys called tubules, and most kidney cancers come from that, and that would be called renal cell carcinoma, or RCC. And that's by far the most common type. Within RCC, doctors can see different patterns under the microscope, and we'll kind of talk about a few that are listed on the slides above. Specifically, clear cell renal cell carcinoma. The tumor cells look pale or have a clear appearance, and that's the most common type. Other types include papillary cell, which kind of have this finger-like growths, as well as chromophobe, where the cells have a distinct border and texture. There are other rare forms, and sometimes cancers can come from other parts of the kidney, such as the collecting ducts, but these are kind of the basic types of kidney cancer. When doctors look at kidney cancer under the microscope, there are some features that may signal that cancer may be a little bit more aggressive. For example, sometimes tumor necrosis can happen, which just means that there are cells within the kidney cancer that have died. And that does seem that it's possibly linked with tumors that are faster growing. Other things that we can see under the microscope are sarcomatoid features or rhabdoid features. They look different under the microscope than usual kidney cancer, and these also signal that there potentially could be more aggressive features. Kidney cancer just doesn't have just one cause, but we do know some things that can raise the risks. Smoking is one of them. Chemicals and tobacco can damage kidney cancer cells, and the risks actually increases the longer or heavier you smoke. Being overweight is one of the things that can also increase your chances of having kidney cancer. Specifically, hormone imbalances can make tumors more likely to form. High blood pressure is another risk that can be linked. Family history is very important. So if your sister or your dad had kidney cancer, you might be at risk of having more kidney cancer. And finally, genetic syndromes that can also predispose you to kidney cancer can be something that runs in your family. And if your family, you know that they have genetic syndromes, you should probably talk to your doctor about they might want to do genetic testing or just monitor you more frequently. Now, I know we talked about these genetic syndromes a little bit, but there are a few that, are very more common. Now, genetic syndromes in general are pretty rare, and examples include things like von Hippel-Lindau disease or Berg-Hall-Dubé syndrome or hereditary papillary renal cell carcinoma. And like I said, they typically will predispose you to having kidney cancer, but also potentially at younger ages, as well as most kidney cancer happens on one kidney. And some of these genetic syndromes, you might have kidney cancer on both kidneys. Often kidney cancer has no symptoms at the early stages. If you do have symptoms, though, the most common symptom you'll have is blood in the urine. It may look pink tinged, red tinged, or even orange tinged. Other symptoms that you could potentially have is pain in the back or pain in the flanks, or even a lump in the belly or the abdomen. Some fatigue or unexplained weight loss. But again, most people don't know that they have kidney cancer. And how do doctors figure out if you have kidney cancer? Most of the time when you're diagnosed with kidney cancer is because you got a picture done in the radiology department for something else. And that's really one of the big ways that we look for kidney cancer as well. When we're looking at kidney cancer, we look at CT scans, MRIs, sometimes ultrasounds. These pictures show us the kidney and any abnormal growths. We can sometimes even do a biopsy to see what kind of tumor it is and if it is kidney cancer. And once we kind of know everything going forward, we can measure its size and kind of look at if it's grown outside the kidney, something we call staging. And we'll talk a little bit about staging now. Staging is used to describe how far the kidney cancer has grown. So has it gone outside of the body, outside of the kidney, and where is it and what the size is. Stage 1 is the smallest tumors that could be found and only resides in the kidney itself. Stage 2, the tumors are a little bigger, but they are still within the kidney. Stage 3, they've started to kind of grow into some of the vessels surrounding the kidney as well as some of the fat that's in the kidney. Stage 4 means that it's the most advanced type of kidney cancer, which means it's gone somewhere else. We have an entire program today talking about, hey, if I have kidney cancer, what are the options for me? So I won't go into much detail about it, but I will kind of touch on some kind of a broad overview of everything going on. Treatment actually depends on the stage, which we just talked about, kind of where the kidney is and how big the kidney is. For cancers found inside the kidney and hasn't gone many other places, kind of the mainstay of treatment is taking that cancer out. How we do that, sometimes we just try to take the kidney, the mass in the kidney out, which is called a partial nephrectomy. But sometimes that's the kind of the location and the size of that doesn't allow that to happen. So sometimes we have to take the whole kidney out, which is called a radical nephrectomy. In other cases, the whole kidney, in other cases, sometimes we may be able to actually freeze it or burn it, something called ablation. And then some options even include radiation as well for some select patient populations. So lots of different options. In kidney cancer that has spread outside the kidney, we use systemic therapies, medicines that go through the body. Two major approaches are targeted therapy and immunotherapy. Targeted therapy usually is a treatment that blocks tumor growth, and immunotherapy helps your own immune systems recognize and attack cancer cells. These treatments have dramatically improved outcomes in patients and in the past 10 to 15 years, and research is still ongoing, and we still have long ways to go, really. A common question that patients ask is, what happens when I do lose a kidney if I have to take the whole kidney? The reassuring answer is that most people do well with just one kidney. The remaining kidney can do a job of both. What's important is protecting your kidney health in general, no matter if you are able to take some of the kidney or the whole kidney. Monitoring your blood pressure and keeping that well controlled is going to be really important. Avoiding unnecessary medications that could affect the kidneys, such as NSAIDs or otherwise, things like ibuprofen can be very important. Staying well hydrated, drinking lots of water, making sure that you're keeping up with your regular doctor's appointments to check up your kidney health, all very important. With these steps, many people live long, healthy lives with just a single kidney. And my last slide is, I think, my most important slide. Advances in surgery medication mean survival rates are improving, but most importantly, support is so important. Support from caregivers and patient advocacy groups is incredibly important, and no one should go through this alone. It's tough diagnosis to hear, and it's a long journey, but we are here with you on every step of the way. Follow-up care helps detect problems early, and having a team of doctors, nurses, family members makes all the difference. I just wanted to plug some of the support groups at the James specifically for kidney cancer patients, and really, encourage you all to think about joining these support groups because, I think it's important for all of us to talk about our experiences as they all are similar but different. And I really am so grateful, like I said, to discuss this with you, kind of talk to you about the basics of kidney cancer and kidneys in general. And I'm so excited for our day and our panel, and I hope you learn a lot. And I'm always here to answer questions. I think we're going to do Q&A at the end, though. So, okay. Thank you so much.